I'm Dr. Samuel Acuff, research scientist in the Recovery Research Institute in the Department of Psychiatry at Massachusetts General Hospital. I'm here with Dr. John Kelly, who is the founder and director of the Recovery Research Institute and also a professor of psychiatry at Harvard Medical School. Welcome.
Good to see you, Sam.
Good to see you too. I want to talk about something that I think is an emerging area of research, but have been around for quite a while, actually. That's recovery community centers. Can you tell me a little bit about what is a recovery community center?
Yeah, recovery community centers, is kind of a new kid on the block, both metaphorically and actually, in the sense that they are bricks and mortar buildings, typically in the hearts of communities. They're non-residential, so sometimes they get confused with recovery residences where people might go and stay and live there and sleep overnight. This is just a place where people go during the day, recovery community center. A bit like you can think of it as like a senior center in some ways. People go to get support for recovery from addiction, as well as access to the kinds of resources that people need in early recovery, both to stabilize and to get traction to move forwards. So these centers provide, and they're populated by peers, of course, with lived experience. So people, the volunteers, they're the people who run them. 99% of the time are people who are in recovery themselves, following all kinds of different pathways to recovery, but all recognize that there are many pathways to recovery, but to provide that real strong, buoyant support for people. So they're very uplifting, positive places. Number one. Number two is they provide all these materials, materials in terms of, they provide a ton of resources, mutual help groups, relapse prevention groups, job skills, job connections, educational connections, mental health, treatment and connections, childcare, as well as a whole array of recreational activities, which is very important in terms of learning how to live a lifestyle and have fun at the same time. So they introduce people and facilitate those kinds of recreational activities as well through those centers.
Yeah. A hub for things that people might need, that would be challenging to go through recovery without, it sounds like.
Yeah, exactly. Yeah. And sometimes these, that array of things I was talking about, the kind of recovery needs, you can think of as broadly defined as recovery capital. Recovery capital you can think of as the entire kind of spectrum of resources that people might need to be able to get traction and move forwards in their life in recovery. So these recovery community centers are designed specifically to provide access to those kinds of resources right there, or to link people to those resources in the community. And so they provide a unique service that's not provided by mutual help organizations or treatment or recovery residences. So they provide something very unique and important in terms of these kind of ingredients of recovery, the skills, the connections that people need, as well as that very positive social support that people often benefit from in terms of that instant building of rapport and trust and social bonds that people, which helps to destigmatize and reduce stigma and reduce that sense of self-stigma and shame that people often have. So they go and they're welcomed and accepted in these entities, and they can really benefit from that and gain access to the things they need.
Yeah, it sounds like a wonderful resource. What do we know about like the benefits of it? How do they work, and what does the evidence suggest?
Well, the evidence is coming along. So these recovery community centers have been, and by the way, they are sometimes referred to as recovery community centers, sometimes as peer recovery support centers, sometimes as recovery cafes, depending on where you are in the country. So just so you know, there's different ways of they're referred to, but there's several hundred of them, not a lot, but several hundred and growing around the country, and also a fledgling evidence base, really uncovering exactly what they do, who uses them, how people benefit from them. So there's been National Institutes of Health sponsored studies now and growing infrastructure designed to amplify the evidence base in this area. What we've learned is that people who utilize these centers are indeed accessing and building recovery capital. And they're not getting that from other places. So these, in fact, are shown empirically to provide these kinds of recovery-specific resources that people can't get in other places. So they're really uniquely providing this, which is important. That, in turn, what we're finding is that access to the recovery capital helps to extend lengths of remission. And it does so by boosting quality of life and functioning, boosting self-esteem, and decreasing psychiatric distress. So the kinds of things which can trip people up in recovery, these things are providing. And by doing that, they're helping people to have longer lengths of remission and sustained remission. So this is good news. The other thing is that we've found that in terms of quality of life and functioning, they're really accelerating the ability for people to reach better milestones quicker in terms of quality of life and functioning and recovery. For example, in the National Recovery Study, which we conducted back in 2015, 2016, we found that in the recovering population in the United States, more broadly, it takes about 15 years to reach the same level of quality of life and functioning as the general population once you're in recovery on average. People who are attending recovery community centers takes about 5 years. So to get to that same level. So there's something about having a specific place where you can go and get the things that you need, benefiting people more quickly in terms of quality of life and functioning. So that's good news in terms of relapse prevention.
Yeah, that shaves off a significant amount of time and hurries along the recovery journey in a way that's pretty significant. So if someone was interested in learning more about recovery community centers, where's the best place to look?
So again, probably the best place would be just to Google these terms in your local area. So if you Google Recovery Community Center or Peer Recovery Support Center, nearly every state now has a version of these types of services. That way you can gain access to the website. It may be under your Department of Mental Health or Department of Public Health, who typically fund these entities in the state that you're in. And you can get access information that way. We also have information on recoveryanswers.org that talks specifically, describes what these centers do and what they are, who runs them, who utilizes them, how they benefit people. And they are free of charge. That's the other thing. I know you were about to ask me this question, but they are free of charge as well. So people can go and access these resources for free. So there's no barrier there in terms of economic barriers. So it's just a matter of finding one of those. You can get support there and then hopefully find the ingredients you need to make your own recovery.
Sounds like a wonderful resource. I'm glad we have some pathways to finding out more about them, and thanks for sharing.
Yeah, thank you.